Good morning, everyone. My name is Jessica Cope, and I'm the Director of Public Relations for the National Funeral Directors Association. We're happy to be with you again for another live Facebook event on the COVID-19 situation. Today's webinar, Communicating with the Public and Using Technology to Serve Families, which is certainly the new reality that everyone is facing. Before we jump in, I just want to talk about some of the late-breaking news we heard yesterday. You probably saw it on our Facebook page or on the NFDA website, or maybe you got our special bulletin, but at the urging of NFDA, the Department of Homeland Security named mortuary workers as critical infrastructure workers. This is huge news, and it really underscores the role that all of you are playing on the front lines responding to this pandemic. You are included with doctors and nurses and all of those who are helping sick people in hospitals. So that's tremendous news. Making sure that funeral directors are considered critical infrastructure workers during mass fatality events has been something NFDA has been working on for decades, and to see that bear fruit during this particular mass fatality incident is huge. And you know, as the COVID-19 pandemic began intensifying globally and it started reaching the shores here of the US, we've been working with Homeland Security and urging them to do this. So this guidance from Homeland Security, it covers essentially the entire spectrum of death care, from funeral directors and cemetery workers and other people who work in this profession. So this guidance, what it does is it helps define for state and local public health officials the professions that are essential to responding to this pandemic response. And it specifically notes that critical infrastructure workers should have priority access to PPE, which I know is something all of you have been worried about. And it also recommends that you be exempt from shelter-in-place orders so that you can do what you need to take care of the people who have died. So, while this guidance doesn't specifically talk about a COVID-19 vaccine once that becomes available, NFDA is planning to reach out to Homeland Security to recommend that recommend that they prioritize mortuary workers for a COVID-19 vaccine once that becomes available. So again, huge win that NFDA has been working on for quite a while. So we're excited to share that news yesterday. The biggest question we've gotten in the wake of that announcement is, so how do we get our PPEs now? So the way this is going to work is the federal government is working on sourcing PPE. The president issued an executive order to ramp up production, and they're working with suppliers and manufacturers to source all of that PPE. And then what will happen is individual states will request PPEs from the federal government. So as funeral homes, you should be in touch with your state and local public health officials about getting PPEs for your funeral homes. NFDA is actually working with the states. We're going to be doing that today to help the states reach out to the state public health officials to make sure they're aware of this guidance that Homeland Security has issued so that you can get access to the things you need to continue serving families. So that work is going on your behalf. So we will have more information for you up on our COVID-19 page later today. So be on the lookout for that. And if you have questions about local access for PPE, again, it's best for you to reach out to your state and local public health officials, as well as your state associations, to get a better understanding of where they are in the process of working with those state health officials to make sure that you have access to what it is you need to serve families. So exciting news there, but let's jump into today's discussion. I'm excited to be joined by Walker Posey. He is the Managing Director of Posey Funeral Directors from North Augusta, South Carolina, and Ryan Thogmartin, the CEO of Disrupt Media. So we're going to talk about a lot of things today, kind of taking the CDC's guidance and understanding how that translates, excuse me, into the way that you serve families and some of the options that you're able to offer them, and also how you can talk with your community about what it is that your funeral home is doing to continue serving families during this pandemic. So I thought, just as a baseline, just a couple of reminders about what CDC guidance is on funerals and visitations. So first of all, the CDC has said that funerals and visitations are safe. There's no risk to being in the same room as the body of someone who has died from COVID-19, even if the body is unembalmed. So we specifically in our webinar with the CDC earlier this week, we asked about Jewish funerals where the body is often, and most times, unembalmed in a closed casket. And they said that's okay. The CDC guidance does recommend that families not touch the body if it's an open casket funeral. So, you know, not touching or kissing, as some people choose to do during our service. The CDC on March 15th issued new guidance for mass gatherings that recommended that for the next 8 weeks until May 10th, that people who organize public gatherings cancel them if they expect those gatherings to be of more than 50 people. Then a day later, on March 16th, the White House released the President's Coronavirus Guidelines for America, 15 days to slow the spread, where the president recommended that there be no gatherings of more than 10 people for the next 15 days, which is like March 11th. So then after that 15-day period, presumably the CDC's 50-person limit would continue until that May 10th date. Of course, many states or cities are putting further restrictions that are a little bit more stringent on those gatherings. Some of them are, you know, proclamations or executive orders by governors or mayors that carry the weight of law, like the CDC and White House 50 and 10-person limits. That's guidance. It doesn't necessarily carry the weight of law, but some of those state and local restrictions do. We had some breaking news late last night where the state of Washington is completely banning funerals. That proclamation by the governor also banned weddings as well. So we'll talk about that a little bit later and how funeral directors can work with families. Washington State is, in those cases, is just permitting direct cremation and burials, but no funeral services. Obviously, that's not necessarily a good thing. It's certainly not what we wanted to see happen, but certainly the situation, as we've all heard in the news, is really dire in the state of Washington. And certainly California has the shelter in place law that, or executive order, whatever it is, that came out late yesterday as well from the governor, recommending that people not leave their homes except for essential things like getting groceries or gas or medical appointments or getting prescriptions. So that, you know, might further restrict the ability to have funerals. It's not clear whether funerals are exempt from that shelter in place a proclamation that's been issued in California. Families still have the choice between cremation and burial. I know there was a lot of chatter about Nevada sending out information where it said cremation was required for all COVID-19 cases, but they later sent out a clarification saying that families do have the choice between cremation and burial. We haven't right now heard of any states that are recommending one form of disposition or another, but certainly check with local guidance from state and local health officials to see if there is anything in your communities. It's important to remind people about healthy habits. The CDC is encouraging this so that if you are hosting funerals or gather or visitations, So that's encouraging people not to attend if they're sick or if they're in an at-risk population, encouraging social distancing, hand hygiene, offering sanitizer, encouraging people to cover coughs and sneezes. It's important to stay on top of that. And again, as we have kept saying, pay attention to what is happening and the guidance from your state and local public health officials, because in some cases, what they're recommending is more stringent than what the CDC is recommending. And so you, of course, defer to those local recommendations. So with that, I'd like Ryan and Walker to jump in, and a lot we can cover here, but I'd like for there to be a discussion about how funeral homes are serving families in the light of these new guidance and some of these new restrictions that are put in place.
Jessica, hey Ryan, how are you, bud?
Awesome, thank you.
Good to be on with both of you guys. I think it's really important to just initially state that funeral homes across America have been serving families during difficult times for generations. So we've gone through wars, mass tragedies, sicknesses before. This is a horrible global pandemic, obviously, and something to be, to take note of and be reckoned with. But it will not stop funeral homes' abilities to serve families. We may have to just be a little more creative in how we do that. So I think it's important that we let our communities know, hey, we're still here. We're going to take care of you. It may look and feel a little different than it has in the past, but we're going to make sure those essential elements of healing are incorporated into what we do. And we're going to find ways to help you deal with this. And that's the comfort they need from us at this time.
Yeah, I would echo what Walker's saying. And, from our perspective of we're not funeral directors, we're helping funeral directors in that messaging and how they're able to continue to communicate and serve. We're trying to monitor, over 40 different state live streams on what laws are happening, what they're suggesting, what the guidance is. And, I think the utmost important thing is notifying and letting the community know that you're there, you're open, you're serving. On all the live streams that I've watched from governors, there's been questions about funeral gatherings and, what's happening with, graveside or in the funeral home. So that communication and staying vigilant for the community and the transparency that needs to come around that conversation. It's really awesome to see the community of funeral directors across the country and really the globe right now rallying together and communicating on, sharing ideas on what other funeral homes in other states are doing. And that's been a lot of our conversation is, funeral homes reaching out, asking what are other funeral homes doing, and creatively kind of all together. I love that word that Walker used, creatively, because that's really how this situation's had to be viewed by the eyes of funeral directors, and then how they relay that to families. They got to get creative.
A couple of days ago, I wanted to put something out to our community, and as Ryan always says, social is really our right now our direct channel to these families we're serving. And so, if you don't have a social presence, it's obviously important to quickly gain that. And I'm sure Ryan can help you do that if you need help. But I said, hey Ryan, I'm going to put a video together. Can you guys post it for me and let's push it out? So we did it. And the feedback we've gotten has been tremendous. And we've had a couple thousand views, and, folks who have been just calling and saying, hey, thanks for the information. People are just, we're in a scary time. And when there's uncertainty, it's good to know that there is that community voice of that trusted provider who has answers. So, and if we don't have the answer, we'll find it for the family, right? So,
yeah.
I just want to remind folks, if you have questions, please throw them in the comments section. I'm kind of keeping an eye on those, and we'll certainly take questions as we go along here. So Walker, as a funeral director, how are you discussing some of those size limitations and whether it's guidance or I'm not sure if you have any specific proclamations or executive orders in your state requiring smaller gatherings, but how are you approaching that with families?
So it's interesting. In the last couple of days, it's changed just from how it was last week, let's say. So last week we were having to encourage folks, it's a good idea to have a private small gathering. This week, people are saying, even funerals we had planned, have come back and said, hey, look, we don't want to do that. We want to have a private gathering. So I think as a society, we know what's happening, and people are latching on to the fact that we have to limit these social interactions in order to be responsible socially and stop this disease. So I'm seeing families come to us with the idea that it's not good together. We're able to then say, hey, look, we have several options. Obviously, we can live stream the service with just a couple of folks there in the chapel present. We've been doing that for 15 years. It's a great way to get folks engaged and to participate in the moment. We can also have a private family graveside service now. And then when the situation changes, we're happy at our firm to then offer families to have a public gathering, at a later time. And so that's been great, a great suggestion for folks as well.
We just had a question come in, questions about meeting with families where there might be a concern about people perhaps being contagious, especially if they've been in contact with a loved one who has died of COVID-19 or been exposed in some other way. What are your thoughts on that? How we might get around that and perhaps not being able to meet with a family in person just for your own personal safety and the safety of your staff?
Technology is our friend today. I mean, we have Family Link with SRS that we can use to meet with families virtually. They can complete all the information they need and really plan the service there from the privacy of their own home. E-funeral is a great option as well. There's several different tools that we have in our profession that if funeral homes have embraced and are using, we're already prepared for these things. So I'm thankful for that, because it is helpful to be able to use that technology to then make arrangements virtually. I mean, really, there's some ways that we can actually do those arrangements basically without the family ever coming in, and there's zero interruption in service, which I think Ryan will speak to, I'm sure, as well. But I think although this is a bad situation, it points out that technology is no longer just a nice thing to do. It's a requirement if you're going to be in business. And so we know that our public today has to use those tools to stay safe. It's very helpful to be able to do these things remotely and not have to have interaction. But in the future, I think that we need to look at that. This is the expectation going forward. People expect to have that as an option. Doesn't mean they don't want to come in ever, but some families do and some don't. So this is a great time to say, let's put these tools in place now for this purpose, but then use them down the road to better serve families.
Yeah, absolutely. We've seen a lot of funeral homes trying to navigate that don't have the technology right now. And how can we FaceTime with a family? And we've had some funeral homes that have gone to only virtual arrangements just to protect their staff and the families as well in the community. So doing arrangements via FaceTime if they don't already have the technology set up with some of the services that are there. We've had some use Facebook Messenger in video chatting through that. Using Zoom, using Skype, and kind of still doing the arrangement old school, but through a screen. And I think those are quick, short-term solutions. I think Walker is very correct that technology is a requirement going forward. And I think that our profession has been slowly moving with technology historically, and this has kind of thrusted everybody into the same boat that you've got to have these resources available for families. And I think I think some value from this is, when families can't gather and they can't meet with the funeral home, I think that there's going to be more value put on that gathering going forward, and more value put on being able to celebrate a life. Because when you take something away and tell somebody they can't do something, or there's restrictions on that, now we want it really bad. And so whether that becomes virtual or that becomes, something that's happening in person, going forward, the way that funerals are planned and the way that funeral directors are communicating is going to change drastically out of this, because we are getting families used to being able to virtually meet and virtually stream. And they've been able to do that in virtually every other profession at scale. And now it's becoming a must-have option. And funeral homes are scrambling right now. How do we live stream? How can we go on Facebook and live stream? How can we do virtual arrangements? And that's not necessarily our wheelhouse on the technology side with live streaming, but we try to help navigate funeral directors to the right places to go. And what's a short-term solution they can have tomorrow, and then what's that long-term plan going forward?
I think it's interesting that, you know, before, I think our fear as a profession where it's very, we're very involved and it's very community based, and we know the people we're serving and it's your neighbor. You know, we feel like I think many folks have felt like technology can be impersonal and that it can be a little bit cold. But this situation we're in has shown us that it actually is the opposite. It actually brings people together. So you look at people who have been isolated for weeks or a month in Italy, let's say, they're FaceTiming, they're having some level of daily happiness by being connected to their people. It's so dangerous for, you know, someone to be isolated for weeks and weeks on end with no human contact. So using technology to FaceTime and to share, you know, to see people is important. So that just shows that people who are dealing with grief can feel supported the same way using our technology tools.
It's interesting how we're learning that even through a screen, you can still develop a relationship and see emotion and feel emotion.
Right.
You know, live streaming, it's so crazy that, you know, live streaming right now is become this big conversation. You know, I watched Kobe Bryant's live stream of his memorial service, and, you know, if you've never been in that position where you've watched something like that, the emotion that you can feel puts you in that place. Yes, you don't have the physical touch and connection, but, you know, and that's been a hard thing as I've talked to funeral directors. We're used, you know, they're saying we're used to hugging a family when they come in to meet us or shaking a hand, and we've had to stop doing that. The way that we're doing removals, where we would just, you know, grab the pen from the nurse at the hospital and we would, you know, lay the paper down anywhere and sign. Like, we can't do those things that way right now. And so, you know, I think it's opening our eyes to the value of technology. It's also putting more value back in how we need that personal interaction, but also allowing us to understand that relationships can still be built virtually. And there's still value in that face-to-face. And let's be honest, like, I don't think either of us are saying that technology will ever fully replace a need-to-need conversation. That's not going to happen, but it is a needed opportunity to be able to provide that.
We say that we try to create a quote unquote virtual community of healing. So we use our website to do that. We have a memorial website, and family can go watch the service there. They can share memories and photos, etc. But it's funny because the purpose of technology is to enhance existing personal relationships.
Yeah.
So we already know each other. We already have this relationship. And in this way, we can support that and grow it and feel it. I mean, I've known both of you guys for a long time, and I feel like I'm sitting in the same room having a conversation. I'm looking at you. When you have a conference call, I always feel like it's very disconnecting.
Yeah.
People are kind of doodling and doing things. But when you have a video call, it's way different. People are paying attention, you're engaged. And so I think using video is really important because it is engaging. When you're just using audio or something, it can be very disengaging, but when you use video, it's very engaging.
Yeah, absolutely. I know. Well, we have for the NFDA office, we have a core group that is holding down the fort. I think it's like maybe 5 or 6 people. You know, the rest of us, we're all working from home, and we're using Microsoft Teams, and we're doing video chats during the day because, you know, we miss seeing our coworkers. So yeah, it's interesting how video has become so key right now, just in our personal lives and our professional lives. Just a couple of things that are coming in on Facebook. Someone said Skype and DocuSign are your new best friends. DocuSign is a really great tool to help you get those signatures on various authorization forms. We have some additional information on our website about navigating FTC funeral rule requirements in terms of what that means in terms of presenting the GPL and getting signatures on various authorization forms. That's on our COVID-19 page in our new FAQ section that we put up yesterday. So go take a look at that. I know some people have been asking about who offers webcasting. On our COVID-19 page, we put a list up of companies that have exhibited with NFDA in the past. We kind of present that we're not necessarily endorsing these companies, but we're just putting put that list there for the convenience of folks who are looking for those tools.
Jessica, I mean, it can seem overwhelming if you are a funeral home who hasn't been doing that, and all of a sudden you have a crisis and the family goes, okay, tomorrow I've got to do this. You're kind of freaking out. We've been doing it for 15 years. We use Funeral One, but there's so many companies that do these kind of things. But it's literally today with technology as simple as, you know, doing a Facebook Live or a Skype call or a Zoom call. Any of these free softwares you can download or use, and it's literally putting an iPhone on a tripod next to where the minister's speaking, and even if you don't have an external mic, it's probably close enough where they're going to get the audio. So you could do this very quickly if you have to.
Absolutely.
Yeah, and with Facebook Live, if the family doesn't want it publicly streaming on your funeral home's Facebook page, you could create a private group where the family is able to invite whomever they want to be part of that private group, and you can stream it right through that private group, giving the family whatever privacy it is they want like for that service. With
software, like with our Life Tribute software, what happens is, you know, we can make it private or public, and if the family wants it private, they can send an email or a social media link out. Very simple. Please, I hope folks will actually use this as a chance to say we need to update our technology, but for the short term, there's so many solutions that just, you know, people don't expect in this time. They want to be able to have the point of the gathering being facilitated. So they're not so worried about how sexy it looks or how slick it was to do. They just want the gathering to actually happen. So.
Yeah, absolutely.
Brian, in our conversation, you've been talking about how families are extending a lot of grace and empathy during this whole pandemic, not to funeral service and just even to other situations.
Yeah, I think we totally we're getting more grace and empathy than ever before, which is fantastic because we just need more of that in the world. But, you know, no one expects a perfect experience when you're live streaming something. Like, technology, more often than not, is never going to be 100% perfect. The video may be jumpy, the audio may cut in and out, but we have a level of you know, understanding of that. The one caveat I'll throw out, because this has been coming up a lot in conversation, is we're getting funeral homes that are calling and freaking out because they've been live streaming via Facebook, and they're getting notifications that Facebook is blocking and muting certain sections of the service because of licensed music that is being played. This will not ding you. There's an appeal process that you can go through with Facebook. And I don't know, Jessica, if you can address.
I can talk to that. So NFDA, for a few years now, we've been offering a webcasting license that allows funeral homes to broadcast copyrighted music through their website. And we recently learned that it also extends to Facebook and YouTube. So, and it covers the catalogs of ASCAP, EMI, CSAC, so 3 major music copyright catalogs. If you need help getting a webcasting license, please call us at the office, and our great member service team will help you with that. And we address this in the FAQ on our COVID-19 page. If you do find that Facebook or YouTube are blocking your streams or taking down recordings, take either a photo with your cell phone or a screenshot, if you know how to do that, and email it to us, and we'll address that with Facebook, because certainly if you have the proper license, that shouldn't be happening.
Jessica,
we also, Scott Gilligan, our general counsel, is also reaching out to Facebook and YouTube proactively to try and navigate around that as well. It's just that Facebook and YouTube, they use these automatic systems to kind of crawl and look for copyrighted music, and it just shuts it down. There's no sort of human mechanism checking whether Facebook has, whether a funeral home has the appropriate webcasting license.
I think
go ahead. I'm sorry, Walker, go ahead.
I was going to say, I think that license, if I'm not mistaken, when you do your NFDA renewal, it's as easy as like checking a box and including it on your NFDA renewal. It's just every year.
Yep.
Which happens.
The webcasting license, it's not very expensive. I don't off the top of my head know what it is.
couple $100.
Yeah, but yeah, it's a simple checkoff box, and it's available to, if you're a member of NFDA, you can have it. If you are a member of your state association, it's open to you. And or if you are a member of one of the FAMIC organizations, so that's, you know, includes like Selected and OGR and NFDMA and those other FAMIC organizations.
That's a huge resource, and that you're going to directly to Facebook to help the funeral homes out. You know, it's been a big concern of a lot of clients, and we're trying to prompt them that, you know, the algorithms that Facebook is using, you know, we're a Facebook agency partner, so we have direct communication with the ads team at Facebook. We're trying to push some of these accounts through with using the ID number and sending that off so they can get approval to not get muted. Most often the recording is not getting taken down. Facebook is just muting the section of that recording where the audio is. But again, this isn't going to hurt your page. This isn't going to put you in bad standing with Facebook. There's nothing like that that's going to happen. There's an appeal process that can take place. NFDA sounds like they've got a direct connection to make that happen for you. If you're under our umbrella, we can take the ID number and pass it along to our team at Facebook to try to, you know, help push that along as well. But you know, that's the other thing. You know, we've got a lot of funeral homes that are posting updates, and in the update, they're putting COVID-19 or coronavirus in the text, and they're trying to get information out to the community and boosting that, and it's getting blocked by Facebook. There is an appeal button that you can hit. You can push that forward for a manual review. Now, Facebook has sent out documentation to agency partners that review process is taking a little bit longer as they're trying to staff up, because obviously every brand right now is doing their best to communicate via the platform because that's where everybody's living. So just be patient. It can be frustrating, but like, things are working in the background. NFDA is going to bat for all of the funeral homes in the US that are trying to do the right thing. So just be patient. The technology isn't always going to be perfect. There's grace and empathy from the community, and just be transparent with what you're trying to do.
Yeah, I just got a note from my colleague. It's $50 for the webcasting license. And we also, on our COVID-19 page, we have a couple of authorization forms for funeral homes that are available to download. One is an authorization to webcast a funeral. So that just, you know, it's legally covering yourself. Make sure that nothing comes back badly on you down the road. And then there's also an authorization to record services. So if a funeral home, if they're, you know, just not able to do live streaming for some reason, they do a video recording of the service and then enable the family to share that out in whatever way they feel is appropriate. There's an authorization form for that as well. And then someone else asked if there's a list of songs that are copyrighted. We don't necessarily have a list, but pretty much any song that's out there is probably copyrighted. You know, there are certainly songs that are in public domain that are okay, but I've seen someone said that even Facebook is blocking or muting public domain songs. So it's a huge issue. It's a huge struggle, but you know, we're fighting the good fight for you on our end.
By the way, it can apply to print materials as well, written poems and things like that. So there's also, it's important to realize, like, you do have to be somewhat thoughtful in what you're printing and doing. And again, that's why NFDA is so important. Having a membership like this with an organization who can say, hey, by the way, we can cover you on licensing. It just makes it so much easier. Otherwise, on my own, how would I possibly ever go get Vince Gill to let me play Go Rest High in a funeral service? It's not going to happen, right? And in South Carolina, we play it every day. So
yeah. I think there's a lot of films that play that song every day. So have you, how are you addressing some of the healthy habits that the CDC is recommending with families about, you know, trying to maintain that social distance? I think that's probably the hardest one in the case of funerals, because, you know, your natural instinct when when you see someone at a funeral is to go up and give them a hug. How are you addressing that with families and trying to encourage those that social distancing?
Printed a nicely worded sign. We have signage everywhere, all over the place, and even we take it to gravesides or to wherever we're going to be. That just says, due to the global health crisis, please refrain from hugging, contact, shaking hands, etc. People come up and they know not to do it. I mean, it's amazing how there's so much information now being discussed on this. This is not something that we're just, it's not just a little minor thing. It's such a big part of our social culture now that in the last couple of weeks, folks know I should not be shaking hands. We have hand sanitizer pretty much at every location where people will be gathering. We know that hand sanitizer actually kills the virus better than soap. I was just reading that this week, but also soap and water is important because it gets the bacteria and grime off your hands. So it's a combination. But I think that, providing those things for families, and then truthfully, for example, this week at Graveside Services, we've made announcements at the end of the service, just please, as a reminder, we know it's difficult not to hug and greet the family, but due to this global health crisis, please, provide your greetings verbally and kind of try to refrain from touching. And people are doing it. They're even in the South, where we're a touchy-feely, hugging society, they're very understanding, and we want to get this thing squashed as fast as we can.
Yeah. And just from the NFDA side, I know we've kind of gotten this request over the last couple of days, just for some recommended signage or language, for a sign as, such as what you've posted in your funeral home, Walker. We're working on that. I know I just, one of my teammates put some copy together yesterday, and I saw it. And I know our graphic designer is working on that. So we will have that up on our COVID-19 page very, very soon. Obviously there's a lot going on at NFDA with us trying to get information and materials out to you. So we're going to have that up just as quickly as we can.
I'll share my verbiage if you have the graphic designer make it. Good.
Great. Let's see. Have you had, Walker, any challenges working with churches and ministers in your community? I know, some churches have, like here in Milwaukee, they've just completely closed down. They're not doing any services in their buildings. So have you had any negative experiences in that light?
No, knock on wood, we haven't had any negative experiences at all. We've had ministers who have been on board with, hey, let's meet the needs of this family, but let's also be very socially responsible. So again, back to not being in confined spaces, we're lucky it's 80 degrees here today. So if you can have an outdoor service of some kind, even when it's 10 or 15 people as a private family service, it's nice to have some space to spread out a bit. And that's helpful. And also, when churches do have policies, it helps the funeral home just reinforce the fact that it's not just us. This is a whole social issue. So we've seen nothing but support from our local clergy. They've been very receptive and wanting to do the right thing. Yesterday we had a small family service, and there were 7 or 8 immediate family, and then there were some folks who really weren't family. There were 2 or 3 folks who were just older folks that were like family to this person. And the priest made an announcement at the end, we're not going to receive guests. We're going to just ease right to our cars and leave. And that's what they did. So even when it's an intimate group, the contact's still being managed and handled.
Absolutely. I want to just in a second pivot to just talking about how funeral homes can proactively communicate with their communities about this whole situation and what funeral homes are doing to continue serving families. But I just wanted to point one other resource that might be helpful to people in your communities. So NFDA is Remembering a Life website, rememberingalife.com. It's NFDA's consumer outreach and education initiative. And we have just within the last couple of weeks launched a blog for that. And we had a post go live yesterday from Dr. Sarah Murphy, who's a death educator and certified thanatologist. And she wrote a great piece about how funeral rituals are changing during the pandemic and how that is also changing the grief experience. So that is a really great piece you can share on social media with your community. We have a link to that on our COVID-19 information page, along with some Remembering a Life social media posts that you can share on your funeral home Facebook page. So look for it on our page, or if you visit the Remembering a Life Facebook or Twitter, or even our Instagram, you can share that out with your community. So as I said, I want to pivot with strategies for funeral homes communicating with their community about your efforts to continue serving families in as safely as you can. So again, lots of things to cover here. So do you want to talk about, some social media strategies? Because as I can't remember who mentioned it, it's the one direct line that you have to your communities.
Yeah, I mean, so for us, gosh, I thought I was going to tell you, Jessica, and I just lost my train of thought. But the point is that, it's important. I know what I was going to say. So it's important to remember in all situations, we are funeral directors. And so that inherently means people are looking to us for advice and for direction. Obviously, there's a fine balance. We're not here to be funeral dictators. We want to meet the family's needs and come to them where they're at, but they're looking for us for advice and direction. So in these times specifically, it's important not to be shy in terms of voicing our opinions and our suggestions, and even if we have policies, why we have those things and how they're there to benefit the family. Social media has been great. We have used social media during this time as our it's always our voice to our community. We've just found over the last few years that there's no better way to immediately get in front of our community than social. And I'm thankful, we use Ryan and Disrupt, not to plug their company, but it's nice to have someone helping with a bit of strategy. So many times we see funeral homes just throwing things up against the wall and hoping something sticks, but we're very focused and have a long-term strategy. Even have my sister is responsible for our social media, but that's her full-time job, is to, even though we have Disrupt, to manage on the ground our community outreach and our social messaging. So we felt like that it was important in this case specifically to just let folks know and be aware that we needed to start thinking about limiting our gathering sizes. So my message to our community, this past week, before it even got as serious as it is now, is look, we need to begin thinking about private family services, using streaming capabilities to do that, having services delayed. We have to limit the gathering size. And we've had a great success. I think that's why we have not had upset people, because they've seen that they're coming in prepared, educated, with the thought of, hey, you know what? That's right. This applies to funerals too. So social helps us get that education piece out there ahead of the game.
And Walker, if you look on Facebook at Posey Funeral Directors Facebook page, Walker did a really great video, and Ryan can maybe speak more to this, but video on Facebook gets more attention than just text. So it's a great way to reach families. It's a great way to put a face on your funeral home in this tragedy and, reassure them that you are still open, that you are there to serve them as best you can. But yeah, I mean, video is certainly an incredibly effective tool on social media, right, Ryan?
Yes. I mean, we're encouraging all funeral homes to, if they're comfortable, record a video or go live. Video gets 75% more engagement and reach than any other type of piece of content. So it is valuable and really valuable from the education piece because of the reach and engagement, but more so, this is a relationship driven profession, and video right now is the way to be most relationship oriented with your community. So being able to put that out, we put out on our Facebook page some suggested language that funeral homes could use in a post to update their community on the situation. But I think it's key to stay ahead of, if you can put content out that is educating the family before they ever come to the funeral home, it's going to make your job and serving them a whole lot easier. And the word that we use a lot is transparency, just being transparent. And, you know, we've had funeral homes reach out that we don't work with. They're like, you know, we're just going to stay off of Facebook. And then they call back, okay, we realize there's no other way for us to communicate. Like, the newspaper's too busy to run any articles and no one's reading that anyways. Like, everyone is on their cell phone right now. So, you know, we've got to do something. And you see a lot of funeral homes scrambling to try to get information out. And, you know, it's important to video is probably the best method. But also just posting, you know, the restrictions that are on gatherings and why. Again, the empathy is there. But we put together 6 talking points that, you know, every funeral home can address that covers a lot of the questions that consumers are having. And so to find kind of those talking points, we're one, you know, sourcing all the questions that are coming through the funeral home Facebook pages that we manage all across the country, but also watching state live streams and the questions that are being asked about funerals and about gatherings, and then passing that along to funeral directors to be able to answer those questions. But, you know, it can be easy to kind of get into a rut of just putting out COVID-19 content. So now that a lot of the restrictions have been handed down over the course of this week, now the strategy and conversation becomes, okay, what can we create content wise to break up this COVID-19 discussion? And, you know, Walk and I had a great conversation yesterday about some things they could do to engage their community. But, you know, it's, you know, creating conversation around what families are doing as they're huddled together. What games have they dusted off? Ask families to post pictures of the games that they're playing and how they're, you know, together sharing stories. You know, I look at a lot of funeral homes that focus their life celebrations on storytelling. There's so many families that are huddled together right now that are having conversations that they typically wouldn't have because there's nothing else to talk about. And so the stories that are being shared that could be archived and used are super powerful. So being able to, you know, have a platform to capture that. And Jessica, you mentioned grief, and Walker did as well. We're helping a lot of funeral homes put together private grief groups that are connected to their Facebook page, because the fallout from this of, you know, especially if more states go to a direct cremation or direct burial and the families don't get the opportunity for that closure, the grief components of that and the fallout of this is going to be quite large. So creating grief groups now where, you know, a lot of funeral homes work with grief specialists that are willing to come on and do Facebook Live Q&As and sessions through that group. And then also even sharing some of that content through the newsfeed of the funeral home Facebook page. So, you know, I think it's important to try to take the funeral home funeral director hat off, step outside as just you as the normal consumer, and what are you wanting to see, and not use the funeral director filter, but just normal, real, everyday consumer. And I'm tired of seeing this type of content. Great. Don't be the funeral home that creates that type of content. How can you empower your community to think of things that are positive? You know, if your staff is at the funeral home serving, you're ordering takeout from local businesses. Great. Take a picture of that takeout, and it's a great way to connect with local communities. We had one conversation with a funeral home where they have a friend that owns a large restaurant in their community, and, you know, obviously the restaurant shut down other than takeout and delivery. And as they were communicating, their restaurant owner said, look, you know, our distribution companies for all of our paper products like toilet paper and paper towels and hand sanitizer machines only distribute to restaurants. I have an abundant supply of toilet paper and hand sanitizer at my disposal with one phone call. What if you do a Facebook Live message with me, because you're communicating to your community how, you know, Mr. Funeral Director, you're involved in supporting local businesses. Let's do a Facebook Live video, and anyone that buys a gift card at the restaurant will get a free roll of toilet paper and a bottle of hand sanitizer as just a thank you for still supporting us. So we're seeing funeral homes and local businesses come together, and that was one of the talking points. You know, funeral homes serve. What are you doing in your community right now outside of just serving families that is beneficial? We have funeral homes that are drop-off locations for canned goods that they're giving to underserved families, because there's kids that aren't getting lunches because school is closed. So there's a lot of different ways to break up this content where it's insanely positive, and funeral homes can continue to be the light and continue to serve even though they're physically maybe not able to meet with a family one-on-one or have large gatherings?
I think it also is social. The key for me is transparency. It eliminates anxiety. And so our job really as funeral directors is to eliminate the anxiety, bring that down for families so then they can make decisions that are best suited for them in this difficult time. So we're not here to sell people things. We're here to actually present options, educate them, and then allow them in a less anxious state to make a decision. So social media, the whole platform of social media, which is a whole other webinar we'll do hopefully at some other point, is really built around, using it as a tool for educating families and connecting with the community, just like Ryan's talking about. Great strategy.
I agree.
I think Jessica froze on us for a second.
May have froze. All right. Well,
there, Jessica?
Technology,
baby.
That's the way it is. Well, is there anything else you want to add, Walker?
I just think that I think this opportunity that we're in, this crisis, is an opportunity for our profession to step back and analyze how can we be better? How can we be better equipped to serve families? These tragedies and difficult times bring to light the things that are our weaknesses. And so hopefully what we'll do is we'll use this as a time to reflect back and say, here's how I can better serve my community. And in the future, when these things happen, we'll be up and running. I'm thankful we already have the technology tools in place to serve our community, but it has exposed, hey, how can I improve that? What can I do better? And that's the whole, if that's a takeaway that we have as a profession, it's just, I think, let's see how we can be better equipped to meet those community needs.
Yeah, sorry about that, guys.
No problem.
My laptop freaked out for a moment.
It's all right.
We are, I think our laptops have been working overtime these last few days and they're just not used to this. Well, we are just about, we're actually 5 minutes over, but I think this has been a really, really great and important discussion for funeral directors to understand what it is that they can do to serve families and keep their communities informed about the ways in which you all are continuing to be out there and continuing to serve families as you always have. I just wanted to point to another couple of tools that the NFDA website COVID-19 page has for communicating with the public. So we developed a news release template that you can customize with information about what it is your funeral home is doing during this pandemic to continue to keep your doors open. You can use that as a traditional press release. There's certainly been, I've noticed in this last week, a lot of media calls have been coming in just to me as the director of PR for NFDA, media wanting to know what it is that funeral homes are doing during this pandemic to serve families. So, there's certainly media opportunities because reporters are looking to cover new story angles. So, that's certainly an option. The copy in that news release template can be the basis for a message on your website or your social media sites. You can use it as talking points for a video if you want to take the Walker Posey approach to creating a video for social media that you can post. As I said, we're working on some other tools like some signage you can post in your funeral home, reminders of those healthy habits, and an explanation of why you may be limiting the size of gatherings. And we also, Remembering Life, I mentioned that blog and social media posts that you can share out on your funeral home social media. Dr. Sarah Murphy, and I think we're looking at some others, are going to be developing additional blog posts related to the pandemic and grief and funerals and navigating that. So more of those are coming. So stay tuned to that COVID-19 page on our website for those kinds of tools. So I'd like to thank Walker and Ryan for their time today and for sharing their thoughts and insights on this highly fluid situation that seems to be changing minute by minute. And I know we're all doing our best to keep up with these rapid changes. The latest information about COVID-19 is on NFDA's COVID-19 page. We have the latest CDC guidance. We also have information from OSHA, certainly things like bloodborne pathogen standards and some other things apply to your businesses, so it's important that you're following those. We also have links to information from the Department of Labor and SESCO Management Consultants, which is NFDA's endorsed provider of human resources consulting services, because certainly there are workforce issues. If you're have staff members who need to be out because they themselves are ill or need to care for a family member who is ill, how you can navigate that, and things like sick pay and sick leave and all of those complicated questions. There's guidance there for you on that. Just yesterday, we added an FAQ, a frequently asked questions section, because we certainly, over this last week and a half or so, been getting a lot of questions from funeral directors, and we've wanted to put all of that information together for you. We have some great videos. The one we did a week ago, last week Friday, with our president, Brian Hightower, and embalming expert, Wally Hooker. We have the CDC webinar we did this past Monday. We have a video from Matt Smith with some great information about doing transfers and embalming. We will have this webinar up there within the next 2 hours. We work to get those up as quickly as we can. So resources are there. Please use them to serve your families and keep yourself, your families, and your staff safe. So thank you again to Wally and Ryan.
Walk around, that's what we would say. Just teasing.
It has been
I'm totally teasing.
a couple of weeks. Oh my goodness.
By the way, thanks to NFDA, because I think for all of us members, you realize if you've ever thought, gosh, I hate to pay those NFDA dues, you realize how valuable they are. There's no possible way that funeral homes across America could serve families in the level we do if we didn't have these kind of resources. So kudos to NFDA and thanks for all you do.
Thank you, Walker. I didn't ask you to say that, but thank you for those kind words. There's, you know, I know I've kind of been doing these webinars for the association, but certainly there are a whole lot of people, you know, there's more than 40 people on the NFDA staff, and we're all working very hard to put all these things together for you. To help you do what it is you need to do to serve families.
Last thing, sorry, before you go.
Go ahead.
One thing I think is important, we didn't talk about so much, is it's important to take care of your staff at this time. Okay. So if we're sick, if our staff isn't well, we can't serve the community. So we're only as good as our health, right? So I think it's important to realize when you're not busy, send people home. I mean, we still pay our folks, but let them go and have as little contact as possible. Have someone there just in case you need someone, rotate people through, whatever it is. When you're not busy in those downtimes, do everything you can to help isolate the situation. So we have to make sure we are mindful of our own health, physical, mental, all those kind of things. Anyway.
Absolutely.
Yeah.
Well, thank you so much, Jessica, for this opportunity. Thanks, Walker. Yep. NFDA, thank you for continuing to keep the info coming. I think it's so key. Like, this is an opportunity for the profession as a whole to be a light and to serve. And there's going to be a lot of focus on the profession going forward. And you're preparing everybody to serve the best they can. So
absolutely.
Excellent.
So thank you, Ryan and Walker. And have a great day, everyone. Be safe out there.
Thanks, guys. See you.